I came in, I was to have a battery replaced in my defibrillator, and I was told that it would be a really simple procedure. It would be in and out, and I even questioned it if it would be in the at the clinic, and they said no, it would be at the cath lab. So I came up to 6 West and 6th floor, and they prepared me, and I signed the consent. He cut into me, and as he got in there, he said, "Oh, there's a cracked lead." So I said, "Well, what are you going to do about it? What do you need to do? Pull it out?" And he said, "No." He said, I can't talk right now. I got to work on this." So I was quiet for a while, and I just felt a lot of like he was hitting me, and I thought, what to me, being a nurse, I thought he was just dabbing at me, getting the blood, but it just hurt me a lot. And it just kind of continued on, and time just kept passing, and I said, "You're hurting me," and he would say, "Give her more sedation." And I was squirming underneath my thing, trying to get away, but I had nowhere to go. And the procedure ended up being a 2.5-hour procedure. And then they wouldn't give me any more medication because they said I had enough on board. There's always a concern that you can over-sedate somebody and then they're not breathing. But I was in a lot of pain. What I would change is first of all, they needed to consent me where the doctor should have come in and talked to me about the risks of having surgery anytime. There's always a risk of bleeding and or infection. I never even thought about a lead being cracked. I mean, that was just never occurred to me, because every time I had the defibrillator interrogated, that should have shown up, I would think, if it was cracked. So I didn't have a clue that there was a cracked lead in it. So I think that's the biggest thing is to have a physician come in and talk to the patient and tell them this is what can happen. I was told that this was a very simple procedure, and I'm sure many of these are done a day because many people have defibrillators and pacemakers. So I think sometimes we can get kind of careless about it. But when this was starting to get into a position of it being taking a long time, and you see a person in the distress that they are, I think that more support should be called in, maybe anesthesia. I would think that you would have anesthesia on call here at all times for these type of situations that come up. Yeah, I just felt pretty alone there in the room, even though I had there were quite a few people around. My understanding was, I could hear them, but yet I couldn't see anything because you've got that shield up. I could just only look back behind me at my IV, and I would see them, doing things with it. It still didn't take my pain away. Dr. Dolan spoke about that, that the OR and some of the other procedure labs were trained with that, and what it was that everybody was an equal member of the team. So if anybody, you wouldn't normally have the cleaning lady, a Carol Burnett, in the room, but if you did, and they noticed something wasn't quite right, they could speak up, and they had a voice, rather than it just being, that this is the captain and he's running the ship, but that everybody had a voice and could speak up, and everybody could be an advocate for that patient. It was pretty traumatizing for me, and I needed to put closure to it, and I needed to talk to the physician about it to try to understand, and I also wanted to know that this was never going to happen again to somebody else.